نتوكل على الله أستاذ أحمد.
السلام عليكم ورحمة الله وبركاته. Hello everyone and welcome to today's webinar entitled by Saudi Nurses Experience at the front line of the COVID-19 pandemic. Thankful for our audience taking time out to be here. Question and answer will be open at the end of the session. Just pop up the question at the end of the page. My name is Ahmed Zahrani. I'm the head of the emergency of this nursing section in Emergency Society. I'd like to introduce today the first amazing presenter, Dr. Amal Al-Qahtani. She is the Deputy Nursing Director of the Nursing Education and Directorate of the Health Affairs Jeddah. تفضل يا دكتورة.
السلام عليكم ورحمة الله وبركاته جميعا. حياكم الله. Thank you, Mr. Ahmed, for the nice introduction and for the invitation to participate in this webinar. I would like to start by thanking the great audience for being with us here in this evening during that challenging time that the whole world is facing. This tragic pandemic is revealing the unique work of nursing for all to see, which can't be more timely with the World Health Organization identification of 2020 as the International Year of the Nurse and Midwife. Today, our discussion will focus on the role and responsibilities of the nursing leadership during crisis, the experience of the nursing administration in Jeddah Health Affairs, the strengths and challenges that we faced, and the future plans. Next, please. We all in our organizations have well-structured emergency preparedness plans for what we know and expect at the time of the planning, but not for what we are facing today. COVID-19 pandemic is different and new for everyone. So we needed adjustment to our plans to fit this current needs. Who can imagine that we would use hotels to accommodate the high surge of positive cases, or even to convert most of the hospital wards to isolation or ICU beds? So as nursing leader, to manage this crisis, we have to have an active role to participate in the crisis command and control committee in your organization, to critically contribute to the crisis readiness plans, to be aware of all plans at the national level, at the other organization that could influence the plan of your organization, other systems, either national system, MOH system, or even the interior defense system. Other peoples and resources that available for us can help and support our plans. Utilizing the readiness, training and education, and this should start ahead of time before even the crisis. We have to be proactive in educating and training ourselves, our managers, and even our staff on the emergency response for any crisis to happen. Next, please. Communication is the most important skill needed when dealing with crisis management. Leaders need to be able to communicate clearly, concisely, and in a time manner during time of crisis. Developing a clear communication plan is very vital. Especially, we need to utilize all the available communication methods especially the electronic ones and virtual ones, to minimize the social contact during this crisis. Next, please. When a crisis hits, there is no time for being panicked or disorganized. Leader self-control is vital in decision-making, communication, and effective problem solving. Nursing leaders need to remain calm and focused during the chaos, be open-minded, and look at the event from different perspectives, think out of the box, have a strong active listening skills with the capability to digest large amount of information that we daily get from different point of view. Be confident, able to make right decision, and be accountable for that decision. During crisis, leaders need to meet people where they are. Staff most basic needs must be met, and they need to feel safe. Leaders need to empathize to the staff needs, feelings, while maintaining control of the situation. As a leader, you will receive several requests from your employee regarding their job post. It could be due to personal requests, personal circumstances, family circumstances, or even health condition. As leader, we have to listen to them, understand their situation, trying to help them, but we have to put in our mind, we need to control the situation. If that request will affect on the overall, let's say, work interest, we will put the work interest first, unfortunately, during the crisis. Next, please. So now I'm going to share with you the experience of our nursing administration in Jeddah Health Affairs during this crisis. In line with the MOH plan to fight the spread of COVID-19, we work in the nursing administration in Jeddah Health Affairs to raise the degree of our preparedness at different dimensions, which include at the regional level, at the nursing in the health sectors, quarantine and isolation hotels. We work we participate with others to develop protocols, guidelines, to support our staff, to prepare for field hospital and conduct research. Regarding the regional support, that happened at the beginning of the crisis, in the beginning of month of March. The first week of March, we respond to the national call where they required support in the Eastern region. So we deployed 17 nurses to support them, and they worked there for more than 2.5 months. We also worked with the General Directorate of Nursing to develop protocols and guidelines for the nursing role in handling COVID-19 patients or cases in the quarantine facilities. The rest I'm going to highlight in the next slides. Regarding our role with the nursing administration and health sectors, we started with ensuring the implementation of the preparedness plan through hospital visits to monitor nurses' adherence to the instructions of dealing with COVID-19. At other point of time later during the crisis, hospitals start shifting and repurposing of their services. So we guide and supervise nursing administration in the hospitals during the expansion of the isolation and the ICU beds, especially with the staffing plans. And this will bring us to the second point, which is nursing workforce. This was a big major issue where we had to think out of the box and see what are our options to cover our needs in all the areas: hospitals, quarantine, isolation, and the field hospital. So during this process, the nursing administration in the hospital started redistributing their staff in each department and reschedule them to cover the work, repurposing the OPD and the primary healthcare center staff to cover general work, and the inpatient staff to cover the isolation and the ICUs. All vacation and leaves were suspended based on the MOH memo. Some hospitals start working 12-hour shifts. And in the current time, also some of them working overtime, reducing the off days. We also started, can we go back, please? Yeah, we also started forming a supportive nursing team from all hospitals to support the affected hospital as needed when outbreak occurs among nurses. This plan was our initial plan. However, later, like mid of April, each hospital developed their own emergency staffing plan. In case of the outbreak happen, they can cover themselves the work in their area. For the training, which is a very important part, we started early in the crisis by instructing all the nursing director in the hospital to make sure all their staff in the hospital, in the primary healthcare centers, in the ports, the airports, and the seaport to be Pixels holder to complete the Pixel training and to attend COVID-19 precautions training as well. Cross-training was done for staff nurses from medical and surgical ward, ER, and the recovery room to the ICU to prepare them to cover the ICU area, and for the OBD and primary healthcare nurses, cross-trained to the general floor to cover in the inpatient department. We encourage nurses to attend educational webinars, and lately, the COVID-19 critical care crash course for nurses started like 2 weeks ago, and it's ongoing. The aim of this program is to prepare the general nurses with the basic critical care skills to be safe nurse to handle COVID critical care patients. Several measures were taken to ensure safety of nurses, either in the workplace or in the dorm. Visual and thermal triage have been established and activated in all hospital entrance. We ensure the adherence to the social distance and isolation measures inside and outside, inside the hospital and in the dorms. We closely evaluate each incident of COVID-19 infection among nurses, and we evaluate the measures that taken for isolation. Daily monitoring for confirmed and suspected cases from our side. Follow up with the affected nurses. We contact them and send them a symbolic gift and a reassurance card. We also raise the issue of PPE shortage to the regional medical supply department, because that will definitely affect the safety of our nurses. Next, please. In the quarantine and isolation, in Jeddah city alone, we have 37 health quarantine and isolation facilities that include hotels and hostels. We support these facilities with near almost of 300 nurses working 12-hour shift with no off, continuous duty. Training was very important at this point because it is a new task and a new environment. We never experienced such experience before. So we trained the new nursing supervisors in each hotel by on-job training, sending them to gain experience from the previous nursing supervisors in previous hotels. Same thing for staff training was conducted in the hotel to cover the infection control and COVID-19 precautions. We develop a description for the nursing role for both categories, staff nurses and supervisors, nursing supervisors in both isolation facility and quarantine facility, because their responsibility are different. We provide continuous supervision, support, and counseling for our nurses in the quarantine facilities. We created a WhatsApp group. We are in contact with the nursing supervisor 24/7 for any issue. We conducted several visits for the quarantine facilities to provide psychological support to our nursing team, especially the newcomers, to reassure them and evaluate their needs. Next, please. For the field hospital, according to the instructions of the Director of the Health Affairs in Jeddah region, we needed to prepare for a field hospital with 500 bed capacity. So as a nursing nursing administration, we started to prepare the plan. We prepare action plan for the preparatory phase and the operational phase. We develop job descriptions for nursing at all levels. We develop policies and procedures. We gather the required forms for nursing documentation, either in a paper format and electronic format. And we prepare a list of manpower required to operate the hospital, the field hospital. And training, of course, important and still ongoing right now, because the field hospital not yet started, but it's soon. So training is ongoing on different topics, infection control and basic nursing skills for those who need it, because most of the nursing manpower came from the primary healthcare centers. So this is another challenge for us. The next part is the support, and this is a very important component of our role in the nursing administration. Support is an essential factor in all times, but it is vital during the crisis. We have to care for our staff to keep the wheel moving. So we conducted continuous contact, follow-up, reassurance of our nursing leaders in the hospital and in the quarantine facilities, as well as for the staff themselves. We make sure that psychological support system is available for the nurses as well as the other healthcare worker in their workplace. Each hospital has their own support system. Either it was in place from the beginning or they established new measures. Of course, our concern is for our infected staff. So we designated a member of our team to be responsible to follow up on the infected nurses with COVID-19, to monitor the rate of infection, to check in on the staff, to evaluate an incident happen, to make sure the isolation and quarantine measures were implemented appropriately according to the protocol, and to follow up on their screening result and report all the results to their organization and until they get out of the quarantine or isolation. Next, please. The second part of our support system was a media initiative. We launched an initiative called Nursing Champions 2020. This initiative aimed to highlight the nursing work and the great efforts they are making in all locations, hospitals, ports, or quarantine facilities. Next, please. Other achievements we made in our administration is conducting 2 studies. One study aims to evaluate nurses' perspective in improving the quarantine and isolation conditions during COVID-19 in Jeddah city. And the outcome, the recommendation of this study was sent to all the nursing director in the hospital and in the quarantine to prepare a correction plan based on the recommendation and suggestion of the participants. The second study aims to identify the nurses' worries, sufficiency of information, and associated psychological distress when they deal with suspected or confirmed COVID-19 cases in Saudi Arabia, and this study is still ongoing. Other achievement was creating a free blog titled Together We Care. It was created with one of our colleagues, Mrs. Shafia Jilani. She created a free blog to provide free access to all nurses to access electronic courses, research articles, and the most important scientific research references related to COVID-19. Next, please. So any experience has its strength, weakness, challenges, opportunity. I'm going just to mention some of those, which I think are the significant ones. So in regarding to the strength, this experience allowed us to discover a new generation of young, talented, amazing nursing leaders who work under these challenging circumstances, but they prove their capability. Teamwork was another strength because those teams came from different organizations. They don't know each other. They came to a new workplace to do new work. There is a lot of ambiguity, but they have the courage to come together and work with harmony. And they develop an amazing teamwork. The other point was learning to work under pressure. And this really applied to all of us. I mean, we've been working continuously during the last 3 months under a lot of pressure, but this experience will sharpen our skills. Cooperation from and support from other administration in the health affair, in the Jeddah Health Affair, was an amazing opportunity and strength for us to help in accomplishing our tasks. Regarding challenges, number one is the rapid changing protocols. And this is expected because COVID-19 is a new disease, and scientists still exploring and examining the dimension of this disease. So there is rapid changes in protocol, and this is challenges because we have to learn and understand and simplify this protocols to make it easy for the staff to understand and keep up with this daily changes. PPE shortage, I think this is global issue, and it affected us in Jeddah region. However, I'm sure our leadership in Ministry of Health and Government is working hard to provide enough supply to the staff. Exhaustion from working long period without off days, and as I mentioned before, it's been very hard 3 months, especially during the holidays, the holy times, I mean. Delayed opening the volunteering, and this is an issue for us in Jeddah, although the nursing administration requested to open the volunteering since the beginning of the crisis. However, for some reason, it's been delayed, and that we lost like a chance of to getting support from other available resources. And we are facing currently an increased need for critical care nurses, and the demand is really very high, and we are trying our very best to work with the available solution in hands to manage to provide nurses capable to handle critical care cases. Next, please. So for future plans, hopefully we are praying to God to end this crisis soon with minimal damage. And of course, after that, we will celebrate. We will celebrate our hard work. Everyone did great job, actually. We have to plan for vacation scheduling because thousands of employees in Jeddah region need to have break. And we have to think how can we accommodate the request of everyone. We need to honor our heroes, nurses. We need to learn from our experience and generate lessons learned from this experience. And we are planning to create and develop policies and work instructions or guidelines related to COVID-19 and keep it ready. Hopefully, God will forbid that will happen again, but we have to be ready in any time. So in conclusion, this crisis shows the heroism and the patriotism of our healthcare workers, especially nurses, who worked hard, sacrificed their comfort, being with their families during the holy times to serve our country and keep everyone safe. They demonstrated with evidence to everyone their capability, professionalism, innovation, courage, compassion, and dedication. Thus, I would like to warmly thank and appreciate every single nurse for the amazing work they did and are still doing during this crisis. You are our heroes, nurses. Thank you so very much for every nurse. And thank you for your time.
Thank you so much, Dr. Amal, for the rich speech. The next speaker is an awesome speaker. She is Basma from Nursing Directorate in Health Affair in Jeddah. Welcome, Basma.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everyone. In the beginning, I'd like to thank you, Ahmed, for inviting me to this webinar. Actually, we needed such webinar. And my thanks extended to the Saudi Society of Emergency of Medicine for thinking about highlighting the role of the nurses in this pandemic. If you allow me, I'll start to share the slides first. I don't know if it's clear, the slides for everyone now.
Yeah, it's clear.
Okay. And one more thanking is going to nursing administration for the effort that they are really doing during this pandemic. Their support, especially Mom Iman. Honestly, all the supports and the strength we are getting on this crisis was coming from Mom Iman. So she was with us with every single second, helping us. So I'm catching maybe the time to extend the greeting to her. It's been more than 2 months now, but she gave us an opportunity to be part of this crisis, to be to have the experience that I think will be remained for a long time. Dr. Amal, she highlighted maybe, or she spoke about the quarantine and isolation. So I'm going to reinforce what she said, or reinforce on what she said. My objectives is going to be to identify the nurse's role in quarantine setting, preparation and operation. Also to identify the minimum requirement to monitor person's health, and to highlight the lesson learned from the current experience. So I'll start just to give maybe simple definition about the quarantine. It's an activity limitation or individual separation for a specified period to monitor person's symptoms and to ensure early detection of cases who may have been exposed to an infectious agent or disease, which is, if I can say, new definition. Maybe it's very old, but it's still new for us here in Saudi Arabia. Having places to isolate people or to limit their activity. And on the other side, we also exposed or have the isolation, which was a big challenge, and it is a big challenge until now. And isolation is the separation of the ill or confirmed infected persons from others to prevent the spread of infection. And for me, I got the opportunity to work in both. So it was totally different experience. Quarantine or even isolation, they might be a place or a source of infection if they were not manipulated very well, if the guidelines were not applied, if I would say, strictly. So the reason for them, the reason why we need them is really to spread, to stop or to delay the spread of infection or any area. However, really, if they are not managed very well, they might be a source of infection. And alhamdulillah, if I can say, so far, I think we are managing, even though the community are having big number here in Jeddah, but I think we're still manipulating very well with those either quarantine or isolation. Many were saying, and I think Dr. Amel highlighted on this part, that we are lacking the protective gear and protocols to keep ourselves and even the patient safe. Yes, we're really having a facing problem with the PPEs and other supplies. But I believe that the authority are working to provide all the facilities that we need to face this pandemic. We're not gonna stop, of course, until inshallah we'll have it diminished. But we still need to highlight on the necessity of having plans, guidelines. I will not also forget to say, yeah, we started to have guidelines from Waqaya, guidelines from the Command and Central Center, and those guidelines were updating regularly based on the outcomes, which is really appreciated. I mean, the effort, what they're doing. But I would like also to say we need to plan for future. This is maybe the first pandemic, but we're not sure if it's going to be the last. So we need to have a future plans. Essential requirements that we needed in order to have a prepared quarantine or isolation. I'll take them from 3 domains. I'll talk about the setting, minimum requirements for monitoring person's health, infection prevention measures. So in terms of setting, I think it was very important to ensure the appropriate setting before starting the quarantine. So one of the things that we're looking for is the rooms, how well ventilated rooms we have for the guests. And by the way, we're not calling them, of course, patients. They are not patient in the quarantine or isolation. We're calling them guests. So because they are, even if they're in isolation, they don't have symptoms. So they are just having the positive results. So we're still dealing with them as guests. Accommodation must provide an appropriate level of comfort, like food, water, hygiene facility, indoor entertainment, and communication facilities. We were thinking about also separation in the elevators and using the highly or strictly infection and control prevention when using those elevators. Possible setting for quarantine, including the hotels and hostels or dormitories, as mentioned in the slides of Dr. Amel. Appropriate and well-vented place for swabbing. And here it comes actually the big challenges, where some of the places were missing the suitable place of swabbing, but we still cope with that challenge. And Alhamdulillah, so far the place is provided with available resources. So we're working on that. Appropriate full equipped room to be assigned as clinic. Education leaflets and hand hygiene instructions, and these were available all the time. And in isolation setting, as it is dealt with as an isolation ward, we had to have the nursing station in each floor. So this is one of the important things that maybe make the difference between the quarantine and isolation. As the guests needs more attention, so nurses number should be maybe different than the quarantine, and they should be available near to the guests when they need them. So we provided those nurses station with phone, thermometer, IV stand, oxygen cylinder, and vital signs monitor. And in some places also we provide the emergency bag. For the person's health monitoring, the minimum requirements were daily follow-up of the person who are quarantined or in isolation, appropriate medical treatment for existing conditions, especially if they are having chronic conditions. As nurses, we should check on them, check their health status, like blood pressure or DM. Screening for symptoms and vital signs, especially the body temperature, and psychosocial support must be provided. Even if we couldn't see the patient regularly, at least by phone, we were contacting them, check on them every shift. Infection prevention measures. Education and training for all personnel working in quarantine about the infection prevention and control measures such as the hand hygiene and the PPEs. And that was or were done by the assist of infection control prevention who were available in the quarantine or the isolation. Monitoring the personnel for hand hygiene and for hand rub frequently. We were working together side by side with the infection control to be sure that all the personnel are following strictly the infection control measure. Personnel trained about the rooms cleaning and the handling of laundry and soiled linen. Standard precaution was practiced by all personnel and all the nursing staff and all the medical staff during that time. Availability of waste management protocols, and availability of regular and terminal cleaning protocols, which was new, so it's been established. The experience itself is new, so everything was newly established. Distribution of enough medical waste in all floors, and determine the personnel doffing and donning points in each floor, which was also an important point. So we will control the contact when they are contacting with the guests or they are entering the room. They shouldn't walk with the PPEs. So we were taking care or taking in our points that we have to have points in each floor for the personnel. For talking about our role in quarantine preparation. So we were thinking about an appropriate place to be used as a clinic, establish a well-equipped clinic, and request all required medical supplies, forms, floor stock, medication. As I mentioned in the beginning, it's newly established. So we're missing all the equipments that we need, that quarantine or even isolation, mimicking the real hospital. Calculate the nursing staff needs over the shifts. Share with the infection control to draw the guest flow, especially for talking about the isolation. It was very important to draw the flow of the guests from where they're gonna enter and which elevator they will use and how we will receive them, as that was very new for us. So we were trying to minimize the contact with all the personnel. We were trying to be maybe closer than the other personnel from those guests. That's why when we're saying we were front lines, yeah, we were at the front lines. So nurses were taking maybe the risk to contact those cases and minimize others to contact them. Ensure that all guest rooms are ready and prepared with disposable dining tools, face mask, hand sanitizer, and secure, of course, the guest disclaimer upon their arrival. So this is just an example of the clinic and how we prepare the clinic. We were looking for the minimum equipments or the essential equipments that we needed in the clinic. So the examination bed, oxygen cylinder, electronic thermometer, vital signs monitor, and pulse oximeter, glucometer, medication trolley, portable emergency bag, defibrillator, and portable section. So nurses were daily assessing the guest, checking and monitor their symptoms, especially, of course, the symptoms which are related to COVID-19. They will prepare and arrange the guest flow during the swab. And this is another story. So how the guests are going to be out from their room to reach the area where the swab is there. So this is another preparation. Emotional counseling to guests and sometimes for their families. And nurses were encouraged to check the WHO as well as the Ministry of Health update regarding the pandemic to keep up on a current guidelines. as the guidelines were still new and still updated. So we were encouraging the nurses to read and to know the update regarding those guidelines. Teaching and provide education for guests about measures and precautions to stay safe, such as the hand hygiene and nutrition. Nurses were working hand by hand with the related specialties and delegating work. And that's for the reason which I just mentioned, to minimize the number of people exposed. So nurses were required to fill in on some duties that were usually covered by other specialties. And that's all just to minimize the contact of other specialties to the guest. So in conclusion, there are maybe some learned lessons from this experience. And I hope that we'll hear one day that everything is back to normal. And we're praying, inshallah, to be going back to the normal situation. So one of the learned lessons that the capability of Saudi nurses to adapt with the new challenges based on the situation. This is one of the things that we know, that Saudi nurses are really, really, really strong, and they were able to capable with the new situation. And I meant here in quarantine and isolation, as it's newly established. Everything was done by their creativity. We were thinking about how to make those quarantine or isolation looks like, or nearly looks like a hospital. Although big number of nurses were infected, the work wasn't affected at all. However, it was smoothly covered. And teamwork was the key to success and overcome all the obstacles. Nurses were able to cover nurses and non-nurses' tasks efficiently. And here it comes why we're saying nurses are really heroes. The rationale and extended use of PPEs and medical supplies were applied to save the consumable, as we have that shortage in PPEs. So we start to think to apply the guidelines of extended use and to rational use of the PPEs. The need for strategic plans to face similar situation in future, it's really, really must. We're not gonna stop in here, for sure. We might face something maybe bigger than this, so we need really to have a future plan and to be well prepared for it. Thanks again for the opportunity, Ahmed. And if there's any question, most welcome.
Thanks a lot. Question will be at the end.
Okay, thank you.
Okay, we are so lucky to have a very unique speaker, Dr. Ahlam. She is the nursing director in Royal Commission Yanbu. The mic is yours, Doctor.
Assalamu alaikum wa rahmatullah. First of all, I would like to thank you, Ahmed, for giving me this opportunity and give me time to share the presentation. Thank you for Dr. Amal and Ms. Basma. Your presentation, it's really amazing. And all what you are talking about the plan, about the nursing administration, about how you really greatly manage Saudi nurses and the quarantine and everything in the COVID pandemic, this is really need some cope management. And I believe in your presentation, you really give us a really great example for how you help your nurses to cope. So our outline for today will be, are you under stress? Do you know how to cope with the stress? Do you know how to move from surviving to thriving? Today, in this lecture, I hope I can help nurses to cope more with this pandemic. So back to the history. I wanted to assure you, you are not alone. It's very common for all healthcare staff to experience emotional stress and distress in this situation. Learning from SARS in early 20s, when SARS attacked the world, there's a lot of staff, healthcare provider, they get the stress and anxiety. In the middle of the crisis, they make a lot of study and they found that most of our healthcare provider, they experience stress, anxiety, depression, and sleep problem. However, in the long term of after 3 and 5 years period, they make a study again, and they found that the healthcare staff didn't show increased level of mental health disorder, but most of them, they have increase in burnout and general stress. In early study in China, in middle of February in 2020, Chinese scientists, they do some study about the healthcare, and they found that the level of stress, anxiety, and depression, the healthcare provider was the same of the general public. So the only problem, the level of sleep problem, it was increased more than the general public. So the healthcare provider, they really suffer from sleep problem. This is lead us to two more important questions. What is associated with more risk, stress, anxiety, depression during COVID? And they found 3 reasons make the self-care provider, their level of sleep problem and the stress, it's more. First, they are worried about family member at home. They are worried to infect them. Also, some of them, they have chronic illness. And we know a lot of our colleagues, they have chronic illness. They are healthy and they are good, but they have chronic problem. Diabetes, hypertension, a lot of normal disease, but it's at the beginning, it was a high risk, one of the reasons of high risk. And also the mental health problem. For example, if they have depression, if any healthcare provider, they have depression or any mental health disease within the COVID, it's really increased. The second question was, what might protect against stress, anxiety, and depression? And they found really 2 amazing factors. One, when the healthcare staff satisfied with the care provided in the hospital, that's mean when the staff really believe in their work and how the hospital administration support them and give them opportunity to work in the safe environment. And also they found that when they feel safe more and their level of stress is decreased, when they feel there is a good supply of PPE and all the equipment. So all this history and pandemic in the world and social media, all these stress factors lead us to think how we can improve our coping strategy. And what is coping? Coping means the process of regulating emotions, cognition, behavior, psychological response, and the environment around you. So first, as a healthcare provider, as a nurses, you have to do self-monitoring. You have to assess yourself. Do you really have stress? If so, you have to know what is your level of stress. Do you need help from others? Do you need to go to psychologists? Do you need to go to the nursing administration just to express your feeling? Do you want to call your friend, your colleague, your family? You have to assess your level of stress. So there is a lot of tools you can use it to assess your level of stress. I give you one example here in my presentation. I will post it in the chat. So you will do self-monitoring and the result will come up and with advice. So based on that, you will feel maybe safe about your level of stress. Also, there's emotional response that can alarm you, or you can understand your feeling. Maybe you are under stress, but you cannot know, but your colleague can help you, can know. For example, if you see someone of your colleague, or you feel you have social withdrawal or hopeless, or you are feeling sleep problem, angry, fears, chronic fatigue, there is a lot of emotional response that can alarm you that you have a problem, you have a stress problem. Once you know your level of stress, that will help you and teach you how to cope. So the World Health Organization gives us some simple strategy about coping. First, you have to be kind with your mind and your heart. You have to be honest. If you have stress, you cannot tolerate it, just speak up. Just tell the people around you that you cannot, simply. So other things to improve your mentally health, you have to do a lot of breath exercise, yoga, reflecting your emotion, and keep to healthy routine, your food, your sleep pattern, a lot of your exercise. Connect with others. It's really important. It's really important to have emotional support from your family. I know most of the COVID team, as in our hospital, they move from their house, from their family. They move to special compound only for COVID team, just to protect their family and protect themselves. So, but keep them in touch, call them, try to contact them in any way. That really will help you. Be kind to yourself and others. You really need yourself and your colleague to be kind. I know it's a stress time, but you can do it. You can control your feeling, control your attitude, your anger. So the most important thing, if you really need help, just look for it. Try to find someone to help you. All this lead us to it's not a new concept. It's old concept. It's mainly used in the company, in business company. But and from around 2012, they start using it in healthcare. But now in COVID, I believe it's trending. Resilience. Resilience, it's a way to cope, help you to cope from surviving to thriving. So resilience, it means the ability to recover from negative life experience and become stronger while overcoming them. It's more broad than cope. We will see now. There is a cycle. Resilience concept give you a cycle, help you to survive, adapt, recover, and thrive. This four recycle. In this four recycle, first step and the first stage of the cycle, you have to know what is the situation. It's really cause you most stress. Maybe maybe the house you move on, or maybe you have more stress because you are left with your family and you really worried about them. Maybe you didn't feel satisfied about how the work in your organization. There's a lot of different causes make your stress level of stress increase. How do you respond to significant setbacks? What is your how you deal and how you respond to this significant cause? The third question you have to ask, how do you feel under stress? When you're under stress, you are eating more, you are exercising more, you sleep more or don't sleep, you have to ask yourself about the most important thing, about how you feel, how you respond, and what is the cause. Second, now you have to adapt. You have to adapt and you have to cope with these changes. And you have to move from your comfort zone. Every one of us has comfort zone, the green zone. You don't want to get out it. But believe me, sometimes when you get out from your comfort zone, you feel better and you will express your feeling more, and maybe you will find a new you. Also in the adapt stage, you have to know if you really get enough support from others. Others mean colleagues, administration, family, friends, all the people around you, psychologists, psychiatric, all the people around you. The third stage, recover. In the recovery stage, you have to know what is really help you to recover. For example, if you want to buy a new phone for yourself, laptop, you have to give yourself something, make you happy and help you to recover from this situation. Also, you have to know in this stage, what is your strength and what is your resources? What is your strength? What is make you really strong and get you adapted well? And now you have to review and evaluate your adaptive stage just to use this technique in the recovery stage. How quickly do you recover? It's really important to know the time you recover and start again. It's really help you when you get the same situation in the future to know your ability limit. So finally, the last stage is thrift. Thrift, what have you learned from all this situation, from the COVID? What really do you learn in the future when you have the same pandemic, the same problem, how you will recover quickly and adapt it quickly? Have you matured as a person? Every experience, negative experience you pass through, you have to find the positive and the light in this experience, and you have to reform it and make it more positive. So when you really know this cycle, this is the normal cycle, every one of us is starting with stage 1, 2, 3, and finally achieve 4. This will help you to understand yourself and increase your self-awareness. The self-awareness can help you to find your stress point, weakness point, and help you to recover quickly. Resilience, it's really help you to strengthen your weakness, increase your confident, and motivate you, and protecting self. The more you know your stress level and you know how to control it and adapt it and recover quickly, the more you will feel healthy and safe. And it also help you to don't burn out. We really need our nurses. We really need our healthcare provider to stay with us, to be happy. So the only way to continue with us and continue in your career is don't burn out. And don't please, be kind with yourself, be easy, be simple, just express your feeling. This all help you to cope well with COVID. Also, there is a role for the nursing administration. And for example, in our hospital, we are try to make the helpline, ask the nurse just to call and ask for help if they really need. We make boxes around the hospital. So we ask our nurses to just please drop your feeling, drop your hope. We really listen, we really care. So there's a lot of study approved, many methods that the nursing administration can use it in the hospital to improve the level of coping, to adjust, to decrease the level of stress within the nurses. And thank you so much.
Thanks a lot, Doctora. Our fourth super speaker is Maha Al-Jaid. She is from King Abdulaziz Medical City, Riyadh. Mic is yours, Maha.
Assalamu alaikum wa rahmatullah. Thank you, my colleague Ahmed, and thank you for the Society of Emergency Medicine to give us this chance to listen to expert colleagues from other parts of the country, as well as from Riyadh. So I would like to talk about the Saudi nurses' experience during the pandemic, specifically the safety and quality part. So let me share my screen first. I can't move the slides. I see the screen, but I can't move the slides.
Just go with the arrows.
Yeah, I'm trying. It's freezed. Let me stop and start again.
You can.
Okay, let's try again. Yep, now it's working. So the outlines of my talk, I'm going to talk about the nursing role during the pandemic, which was touched base by other speakers. So I'm going to summarize it. And I will talk about the leadership role in ensuring safety, as well as the concept of resilience, which is beautifully explained by Dr. Ahlam. So I will focus on implementing hospital policy and infection control policy, nurses' role in disaster planning and triaging system, nurses' leadership role in foster education training during the pandemic, allocation of resource and proper resource management, including staffing as a resource or manpower, communication and why it's very important, coordination care between different departments and different healthcare disciplines, as well as why resilience and teamwork important during disaster management and during pandemic, as well as the role of...
excuse me.
Yes, تفضل.
Slides ترى مي ظاهرة.
مي ظاهرة. طيب, let's... share screen and طيب.
لا حطي share PowerPoint.
I did. So you can see now.
الحين ظهر السكرين حق الديسكتوب.
I did share the PowerPoint. So you can see. But can you share my presentation from your site? You have my presentation.
طيب, let me download it. Just go on until I'll download it.
Okay. So basically, we know a little of backgrounds about what happens with COVID globally and locally in Saudi Arabia. So the COVID-19 has hit China in December 2019, and from there it's become unwelcome guest to all countries around the globe. So in January 2020, the World Health Organization declared COVID-19 as a public health emergency, and the first case reported in Saudi Arabia was in March 2nd. From that time, Ministry of Health took initiatives as a healthcare authority of the kingdom to establish rules and measures to reduce the risk of spreading COVID infection and early detection, as well as principles of isolated of suspected and confirmed cases. So we know that they took a lot of measures, including travel bans for both local and international flights, closure of the mosque, stopping of in-person social gatherings, screening of travelers in the airports, screening of visitors in the hospital, activating of RI screenings. All these measures were there in place in order to early identify potential cases, isolate them, so trying to control the spread of the infection within the community. So can you see the slides now?
Not yet, I'm working on it.
Okay. So I'll stop until you are ready. I have a message, your screen is shared. So do you see my screen?
Yes.
Right. When I move the slides, you see the PowerPoint?
No. You just
How
off
about
off
others?
off your sharing screen.
Okay. I did.
Okay, I'll try mine.
Sure. Sorry for inconvenience for the audience.
Maha, just go on until I solve the problem.
Okay. Right. So as part of the global response to the pandemic, the International Labour Organization has published a report that mandates all member organizations, including healthcare sectors, to have a minimum requirement to ensure safety and quality, and basically the safety of the healthcare workers as well as other workers within the healthcare sectors, so non-healthcare employee. So these requirements include basic requirement of hygiene and cleanness and waste management, proper use and adequate supply of PPEs and protective gears, training and competence for staff who are in direct contact with the patients, implementing social distancing policy, being led by a responsive leadership that have a robust mechanism of implementing prevention measures, as well as both authorities and regulation, as well as penalties for organization that does not meet these minimum requirements. So when we talk about safety and quality, we should touch based on the guidelines and policies that are regulated the healthcare sectors during the pandemics. So from Saudi perspective, the Ministry of Health is the leading healthcare authority during the COVID-19 pandemic. They work collaboratively with the Saudi CDC, and they publish the corona infection guidelines. These guidelines focus on three main concepts. The first one, which is very important, is early detection of the cases, reduce the risk of infection, and then reinforce public health measures that are known to reduce the viral transmission or spread, including social distancing, educate the public about cough etiquette, hand hygiene. So during crisis, what is really important that during crisis, what we see is increase in the demand and limitation in the capacity or supply. Having said that, even during crisis, we should not leave patient safety and risk management at the back corner. They should be upfront in any disaster management plan and outbreak management plan. So hospital and organization must have active risk management and quality department unit. They have to be part of the pandemic command center. Infection control are integral team leader of the command center. They have to evaluate, update, and regulate infection control measures during the pandemic, as well as the healthcare nurses, especially the nursing leadership. They have to ask themselves at higher level of management, executive level of management, as well as mid-level of management. So if you are a nursing leader during this crisis, ask yourself, if I'm a risk manager of my unit, what should I tackle first? How I'm going to study the major risk in my units to address their implications on care of potentially highly infectious patients that could affecting my staffing. So we need to implement risk management tools. We need to implement strict infection prevention measures. We need to have availability of trained staff on how to use the PPE, as well as adequate supply of the PPE, and empower staff to speak up, to speak about quality, to speak about breaching of hand hygiene, to speak about the breaching of PPEs. So in terms of the impact of the pandemic on the critical care site, we know that emergency and critical care, as well as acute respiratory units, are hit, major hit by this pandemic. So the Saudi Critical Care Society have published their clinical practice guidelines to manage patients with COVID-19. These guidelines emphasize in so many aspects of care, including availability of equipment and resources, availability of trained staff, as well as the detection of the patient, and have a dedicated ICUs to manage those patients. So you will not manage them in a mixed ICU. They should be managed in a negative pressure room suitable for those kind of patients, as well as we know about the challenge that globally faced by availability of enough ventilators and enough ICU beds to manage those patients. So nurses leadership have integral part of being part of the command center, as well as supply and equipment chain. They play a major role in ensuring the availability of the equipment to provide safe, effective care for all clinics that care for COVID patients. Did you see my slides now?
Yes, we are in safety and quality.
Yes, now we move to slides number 7. Safety and quality. So when we talk about safety and quality, there are 3 main concepts that each nursing leader has to make sure that they are in place to ensure safe and effective care during the crisis. Being prepared. Being prepared is very important. Preparedness and responsiveness allow delivery of safe care, as well as minimize potential error. So leadership, all level of leadership in nursing, whether in higher level of authority as at minister level, at Ministry of Health level, or at local organization level, leadership, they must ensure that they have integrated best practices within their policy and procedure to manage those patients, that to increase the safety and try to reduce error. Organization must adopt safety culture, measure their safety culture within the unit, and promote safety culture within their units. Ensure that there are enough available resources in terms of manpowers and equipment, as well as enough training if we need to mobilize the staff from one area to another area to support COVID managing patients, clinical units. So in Saudi Arabia, we know that the Ministry of Health is leading the command center of disaster for the country. So what happens in the Ministry of Health, because the country has established early robust mechanism to face the pandemic, if you compare our healthcare system outcomes so far in COVID compared to the global outcomes, we have 0.6% mortality and 74% recovery rate. This is tremendous results for a healthcare system in Saudi Arabia, and we should be proud of what we achieve. Talking about the third important part is, we know that nurses have ability to work under stressful situation. However, our ability to work under stressful situation, it should match our ability as a leader to maintain and sustain clinical care, delivery of safe care, even during the pandemic. So we have active role in ensuring that we are responsive to the system change. Our leadership is flexible as well as organized to absorb and prioritize the demand and the needs. We should acknowledge the physical and emotional impact of this increase in the demands on our frontline staff. We should utilize supportive team as well as supportive leadership to ensure the quality of care. We know that nurses are working now consecutive shifts. They are working more overtime. Some of them are actually isolated themselves from their loved ones and their family in order to protect them from cross-infections. All this has a huge impact on the nursing psychological as well as physical performance. So as a leadership, we have a role to protect our staff safety. So what we are facing now is two different directions. We have increase in demand and limitation in capacity, and the time factor is not in our favor. So what we need to do? Number one, we need to set a priority to maximize the outcomes as well as minimize the error. So how do we do that? Is there a principle to set the priority and make sure that we have a fair allocation of resources for those patients? And I will discuss it in the next few slides. Number two, availability of the diagnostic and therapeutic in the organization. Organization X receive X amount of patient. Does that place capable to manage safely those patients, ensuring they will be safe as well as the safety of the care providers? So this is another important task. So each hospital caring for a patient during this time, they must have a disaster committee, a command center that rule and regulates works during the pandemic. Access to care is very important. Availability of medications, availability of treatments. We know about the royal decree from King Salman early during the COVID outbreak that there are a royal decree to treat everyone, Saudi national, non-Saudi national, even illegal immigrants. That has a huge impact in reducing the spread of the infection within the community. However, looking to these numbers of patients, does our healthcare system have the capacity in terms of manpower and resources to accept this influx of patients? So hospital must have a pandemic plan, or basically a disaster escalation plan to face this surge of patients, surge capacity increase. So at King Abdulaziz Medical City, nurses, they sat in the command center and nursing leadership, actually, they formulate with the medical services what we call it the infection disease epidemic plan, the IDEP plan. This helped our organization a lot during the pandemic. It helped us to set a priority to which clinical area we should identify to manage, basically admit, assess, and manage the patient with either confirmed or suspected COVID, ensure that we have adequate capacity from space allocation, equipment, supply, ensuring availability of trained manpower, as well as minimize the risk of infection. Just within the 2 months, that March until May, there was a huge increase in the number of HEPA filters that our hospital purchased to use to support patients to be treated in a negative pressure environment, especially during a result generating procedure. There was also a robust mechanism that nurses set every day in the equipment and supply management committee to manage necessarily equipment, and we have daily with the patient safety with the safety and quality department as well as nursing department, daily update on the situation of our resources. So when we talk about resources, leadership has to ensure that there is a fair allocation of resources. So this review from the United States was published early this in May, and they basically have specific criteria to make sure that we have ethical, value-based resource allocation. These principles include prioritize clinical units that have managing those type of patients. So you prioritize, for example, ICU that manage COVID critical care patient. You prioritize inpatient area that manage positive ward COVID patients. You prioritize healthcare worker who works in the front line with those types of patients, like emergency department, flu clinic staff, acute respiratory unit staff, and then utilize evidence-based practice to guide resource allocation. So again, infection control department should take the upper hand to manage the situation and to lead the situation. And then we have to think about, how about non-COVID patient? Still emergency department, still ICU, still inpatient area, receiving patient with acute care needs that need to be admitted to the hospital. Patient with MI, patient with a stroke, and other emergency. So one of the basic ethical principles that to treat equally. So we have to make sure that there are same principles for COVID patients that will not affect the quality of care for non-COVID cases. So our role is to preparedness. We have to be prepared. Talking about preparedness, the World Bank emphasizes an importance of a preparedness, that outbreaks preparedness is very critical to national security, as well as strengthening of healthcare delivery system. So, did we learn the lesson? Is it the first outbreak? No. The world have been hit by multiple outbreaks. So we all know about, or we heard about the Spanish flu that affected the world in 1980. There was a 50 million life lost during the Spanish flu. So I will share with you this little story for a nurse from the United States. Her name is Dorothy. She's a nursing student who used to work on the flu ward for 12-hour shift, consecutive 6 weeks without break during the Spanish flu. So she literally said, I live in the thick of the pandemic. So nurses are really the frontliners. So what we do to help the frontliner and protect the frontliners. We know that in 2020, which is 100 years after the Spanish flu, coronavirus hit the world with a rapid transmission rate, whether locally or globally. So what did we do? Nurses, they became integral part of being one of the major healthcare disciplines that work on the pandemic team. So they make sure that there are effective teamwork, high level of coordination, clear communication during this stage of response to COVID-19. So the nursing team have the ability to maintain and sustain the clinical services to ensure that healthcare system is safe. Do we do it alone? No. But we are in the core team of operations in terms of managing COVID-19. So the question is, do we learn the lesson? Spanish flu happens 100 years ago. What did we learn? So this slide shows us, here you can see that 2 different states were hit by the Spanish flu. Philadelphia state refused to enforce prevention measures of social distancing. And within 2 weeks, their number of cases is sky high. In contrast, St. Louis started to implement early measures of prevention, which is social distancing. And within 2 weeks, there was a big difference between number of cases reported in Philadelphia compared in St. Louis. So there are 3 to 5 times increased cases in the area where social distancing was not implemented. So we know that Ministry of Health, even now with more ease of the regulation, they still educating the public in all social media channels. All healthcare sectors are mandated, as well as private sectors, including non-healthcare sectors, that they should have policy in place to regulate and mandate social distancing. We know that also Ministry of Interior have put penalties in institution that does not maintain social distancing and does not promote hand hygiene and screening, temperature screening, which is very good. The mandate of universal mask in the community. That's also another excellent measure that will, inshallah, help our community to go over this outbreak. So how about us in Saudi Arabia? Did we learn the lesson? We know that United States 100 years ago and now, they haven't learned from Spanish flu. So did we learn the lesson? So in 2014, we were hit by MERS-CoV. And in that time, there was a closure of emergency department in our institution because it was the source of spreading the infection to the entire hospital. So what happens? It was a very tough decision to the senior leadership to take, but we must take it in order to survive the MERS-CoV. So did we learn the lesson? Yes, we learned the lesson. It helped us tremendously in preparing for COVID-19. Not only that, literature indicate that nurses' previous experience with major disaster outbreak influenced their preparedness to manage disaster. So what else leadership can do to manage the pandemic? We know that leadership engaged in implementing and of policy that has rapid identification, isolation, provide a sustainable workforce, ensure that we have adequate supplies, as well as maintaining the quality of care and the clinical management level. Implementation of prevention measures is very important, as well as implementation of policies that protect both patients and healthcare workers. So we have a role as nurses to raise our voice, to engage as an active member in the command center, that raising the capacity to respond to the demand should not come overpricing the safety. So we have created in our organization, nursing team have created the new pathway for RI screening in collaboration with Infection Control Department. We have established hand hygiene station in every hospital entrance. Hospital policy has changed to prevent visitors. Medication delivery system were put in place to avoid patient coming to the hospital only for refills, which is very important step. Clinical operation has been changed. Clinical area where the demand was not as high as the COVID potential area early in March were moved to virtual clinics. So the outpatient services moved to virtual clinic. There was larger use of telemedicine. There was more integration of technology. So to ensure social distancing and avoid large crowd gatherings in meetings, we start to use technology to meet with stakeholders, with decision makers, and we discuss in a daily debriefing and daily updates on the command center plan, operational plan during the COVID outbreak. So staff were trained in terms of training on donning and doffing, training on effective hand hygiene, N95 fit testing, and all other measures that can protect our staff. We should be committed as a community. So as a member of the community, not as a healthcare provider, I would say that Ministry of Health, Ministry of National Guard, whatever healthcare sector you are thinking about, they have done tremendous job. What about me and you as a person, as a Saudi citizen? What did you do to protect yourself, to protect your community? So we have responsibility, and with the ease of the regulation now, the responsibility falls on us. So nursing leadership also are important in managing the model of care to basically minimize negative impact on healthcare, as well as trying to minimize errors and minimize negative impact on healthcare. So far, we have a huge increase in the demand, operational demand for COVID clinical units all over the hospital, from emergency, critical care, inpatient, as well as outpatient flu clinic. Still, we were able and successful to operate fully with the resources that we have. And that's the strength and the beauty of the nursing. Nurses know how to sustain resources. Nurses know how to adapt to change. And these traits goes back to high level of professional commitment and high level of resilience that nurses have. So I'm going to share experience from our organization. So we have established a new pathway for screening staff who were potentially exposed to a COVID cases or who have a flu-like symptoms. So earlier in March, the healthcare administration has agreed to move the employee flu clinic to a dedicated clinic outside the hospital premises in order to avoid exposure and mix of cases. The same principles were also applied to open a public health contact tracing clinic that serve public who were potentially exposed, so they need to be swabbed for COVID-19. There was a tremendous effort from every single person, nursing, housekeeper, informatics, medical, infection control, to make this happen. And what happens in COVID clinic or flu clinic, it happens 10 times in the inpatient area, in the critical care area, in the emergency department. So the effort cannot be highlighted by word, but it can be shown by the number of cases and the level of success Saudi Arabia has reached, 0.6 mortality and 70% recovery rate. And I hope it will reach more than this. Okay, part of our role as a leader to ensure safety is to educate our staff. So COVID education now is almost accessible by webinars, by Saudi Health Council courses, Ministry of Health courses, Ministry of National Guard courses, as well as public. We know that Ministry of Health had a dedicated team working on public awareness through official media channels, social media, as well as within hospital premises. We need to make sure that we have adequate protective equipment. So nursing leadership are integral part of supply management. And they play a major role to ensure that staff in the front line are protected and safe. Part of that also is using technology and simulation. When we use simulation, we basically improve our performance. Research shows that simulation improves responsiveness to infectious diseases outbreak. In our organization, we do drills also to mobilizing patients with using isobot mobilization of patients with potential airborne isolation. So these disaster drills help us now to mobilize patients when they are need to be mobilized from one area because he was not anymore suspect. Now he's a confirmed case and he needs to be managed in a COVID confirmed case unit. Or he's not anymore, he's a COVID positive, not anymore critically ill and need to be moving to inpatient COVID units. So these are very important. Disaster training is very important to face pandemic. Innovation and technology, like what we have now. All this era of COVID-19 increase using of technology, distance learning, telemedicine, and others. So I believe when this is all over, inshallah, the world will not be the same. Pre-COVID era should not be the same after COVID era. So we need to rethink. Teamwork. Teamwork is integral part. Nurses can do tremendous job, but we can't do it alone. So as Mother Teresa said, we can do all small things with a great love. but together we can do something different and wonderful. So in no times during the pandemic, and literally no times, we have a clinical units that were open, fully operated, established from zero, from scratch. So that indicates how much we are professionally committed and how much resilience we have. Dr. Ahlam has mentioned the concept of resilience and beautifully explained it to us. Psychological resilience is very important because it depends on you as a person, as a nurse, as a profession, that your interpersonal factors will interact with the environmental factors. It's your endurance personal trait that give you a way or a layout to regulate and control yourself during the disaster. So what can we do? We saw nurses in the social media during the COVID outbreak and in the news headlines that they go above and beyond to save patients, to put their patient first. How about putting our staff first? So it's very important to discuss this concept. I'm sure that this is not a new picture. We've seen a lot of nurses during the outbreak in China and Italy and all other parts of the world. They have facial injury, pressure injury because of wrong use of mask. Some, they shave their hair in order to make sure that there is less risk of infection. Some basically give up in their break times in order to save their patients, so they work long extensive shift without even ability to drink water because they cannot go out, doff layers and layers of BBEs, come in and done layers and layers of BBEs. So nurses, they did a tremendous job to protect themselves. Our colleague from Bahrain, they did a very wonderful strategy. They utilized a human factor framework to manage the COVID-19 pandemic. So what they did is basically the human factors framework focus on 5 elements. Elements number 1, patient safety. So ensure safety at all times. Element number 2, problem-oriented things. So nurses should have a dedicated intention, non-interrupted time during the care that they give. Technology integration, which I have touched based on it. Implementation of human science and integration of human science. And resilience is part of human science. Compassionate leadership is part of human science. Working environment design. So some units moved from nothing to an ICU that manage COVID patients. So there are a lot of work that had been done. So we need to acknowledge that what nurses does during the pandemic is above and beyond in terms of protecting themselves or protecting their patient. So as a leaders, we have to have a compassionate leadership to our frontline worker. So I'm going to read this statement for you. If you would ask me, and this is from Dr. William Carson. He was the director of Department of Medicine in Philadelphia during the Spanish flu. So during 50 million life being lost within no time. So if you would ask me 3 things Philadelphia most need to conquer the epidemic, I would tell you that nurses, and more nurses. Doctors, we have enough. With all of my respect to all our colleagues, supplies are plenty. Buildings are there, but without enough nurses to train, to deal with those patients, we are helpless. So yes, you should be proud. You should be proud for the service that you are giving. You should be proud for the role that you were recognized for. WHO have recognized 2020 as the year for a nurse and midwife. And that doesn't come from nowhere. It comes from the huge contribution nurses give to the healthcare system. So part of acknowledging nursing rights is support them psychologically as well as support them financially. Okay, so there was a study that was published in JAMA last month in May that looks for psychological impact of the epidemic on the Chinese healthcare workers. So they studied 1,200 healthcare workers and they identify that 44% have anxiety, 71% have distress, 50% they have depression-like symptoms, and 34% have insomnia. So we need compassionate leadership. We need to activate, if not already activated, the mental health counseling, staff wellness clinic, dedicated hotline to support mental health issues and breakdowns during the outbreak. And of course, we need a more robust mechanism to acknowledge their financial efforts. So I would like to finish with this funny message, but it's a strong, potent message. How about stop calling them hero and start by paying them more? Thank you.
Thanks a lot, Maha, for the beautiful lecture. Our last speaker, excellent speaker, is Dr. Asima. Dr. Asima, you have the mic. She is the PhD nursing she got a Master of Critical Care. Dr. Asima, mic is yours. Dr. Asima?
Yes, can you hear me?
Yes.
Okay. If I just may ask, how much time do I have so I can make sure I
15
don't...
minutes more.
Okay, thank you. I will try to share my screen. Can you see my screen?
Yes.
Okay. Okay, sorry, 1 second. So I am mesmerized by the talks and the attendance. We have more than 900 participants. As you've seen, the speakers have tackled it from different point of views, and we're all discussing COVID at the end. I am honored to be amongst you all. Thank you, Mr. Ahmed, for the invitation, and it was well orchestrated, well organized, and well implemented, as you see with the presentations. I am proud to be amongst you, and I will, since it's the last talk and many have mentioned many of the things I have in my presentation, because infection control would go in all topics, so I will not bore you and go ahead if it was a repetition. Okay. So in my presentation, I aim to identify infection. Did it proceed to the objectives, Mr. Ahmed?
Yes.
Okay. Identify infection prevention strategies needed to care for patients, confirm suspected cases in healthcare setting, outline evidence-based recommendations, best practices, and guidelines for managing COVID-confirmed suspected cases. So as we all know, and as you've seen from the presentations as well, COVID has impacted the world in many ways, not only Saudi Arabia, and the role of healthcare workers in response to COVID extremely important to provide the necessary support to suspects and confirmed cases. Unfortunately, many healthcare workers have acquired COVID-19 infection all around the world, and there's always been a need, and many leaders have implemented immediate special attention to prevent healthcare associated transmissions. We need to specify it's from patient to patient, or from patient to healthcare workers, or healthcare worker to patients as well. So although PPE is the most visible control measure used by healthcare workers to prevent COVID, yet it's it is only one of the IPC measures and should not be relied on as a primary prevention strategy. Dealing with suspects or confirmed cases require transmission-based infection control prevention precautions on top of standard precautions on risk management. Hospital directors need to assign, and as discussed in the previous presentation, full team for infection control prevention to develop and supervise and implement procedures and policies accordingly while training staff as well. So other viruses might be somewhere else, but they're still there, and we hope we don't have to deal with another pandemic. However, what is the estimated incubation period of COVID, the disease caused by novel coronavirus, as we all know? So we know from a recent article that a known contact, there's a median of 5.1 days to the start of the symptom. And as you see, 99% will develop symptoms within 14 days of being exposed to patient. What we don't know is the latent period, when the patient is infectious and how long they may be infected before they develop the symptoms. Other studies have shown that the positive test 1 to 2 days before the symptoms. So in terms of the viral shedding, because when we discuss infection control, we need to look at the viral shedding. And this is an interesting study by Zhou et al. And there were 191 patients in the study, 137 patients discharged and 54 died. The median duration of viral shedding for survivors were 20 days. The shortest was 8, while the longest was 37. Non-survivor viral shedding continued until death. However, if you look at the graph, the median duration of viral shedding was longer than the median duration of the symptoms of cough and dyspnea. So even when they stop showing symptoms, they could be still positive, and we'd like to put this into our consideration. In another study, in terms of the prolonged fecal viral RNA in hospitalized COVID patients, Wu et al. Found that 98 patients with respiratory and fecal infection, of those 55% had positive fecal sample. What is very interesting is the mean duration positive respiratory was 16.6 days post symptom onset, while the mean duration of positive fecal was 27.9 days post symptoms. And just in the picture, it's a busy one, but if you could see, the red one is the throat swabs and the yellow one is the fecal swab. So here, this is an indication that fecal feces shedding exceeds duration of respiratory tract. Although there wasn't any association with the GI symptoms or disease severity, fecal are a potential source for transmission by symptomatic, previously symptomatic, as well as symptomatic carriers. For patients' education and staff education, this is very important. So, what are factors affecting transmission? Definitely the aerosol generating procedures, direct transmission by early, even asymptomatic carriers, duration of exposure, equipment surface, face touching, very important, and PPE, and patient coughing or face mask wearing or not, and portable exams and that the patients go through. In this study, the spread of COVID in 3 negative pressure room isolation room in Singapore showed that before cleaning, 13 to 15 rooms, there was an 87% tested positive, including non-obvious sites, such as at the window and air outlet fans. However, after cleaning, they tested negative. does this study indicate the importance of good cleaning and air sampling in the room maybe would have been negative, possibly due to the negative pressure. So again, the virus on the air vent is suggestive of airborne. Persistence of COVID on surface in aerosolized form, you can see, and this picture, however, somehow circulated around the media. So you see that with the viable virus after application, the aerosol at least 3 hours, because that's when they stopped testing. However, on cardboard, it was there for 4 hours, and then stainless steel and plastic, it stayed for more than approximately 72 hours, which is 3 days. So again, disinfection is very important between patients, and this is a huge problem. So now, I hope you're all with me, because I know it's the end of the last presentation. However, in this study, touching the face. Do we touch our face? We are so accustomed to touching our face. And just to keep you all in attention, I've been watching Mr. Ahmed this session, and he touched his face 15 times during the session. And then I stopped counting, so I don't know how long he'll continue after that. The idea here is we are so used to touching our face. In a study where there were 26 observed students touched their faces 23 times per hour. He touched his face 15 times per hour. So kind of 44% involved contact with mucous membrane. Of mucous membrane touches observed, you see 36 involved the mouth, and 31 involved the nose, and 27 involved the eyes, or 6 were a combination of regions. So this is very important. There also, in another study, we have 10 nurses. They were asked to wear an N95 mask. It wasn't an outbreak, it was just for the study. And they could remove it if they went to the bathroom or if they were on a lunch break. So the mean of face touching was 25 per 12-hour shift. Potential virus transfer could transfer to the mucous membrane, and mask and N95 only protects you if you don't touch your face. So we could could wear all our PPEs, but then we really need to focus on not touching our face. There's another recent study in May 25, the risk of COVID among frontline healthcare workers and general community. In a prospective study, they looked at COVID symptoms using smartphone application. They compared with community frontline healthcare workers, had a hazard ratio of 11.6 for reporting positive test. When they also looked at comparing healthcare workers who did not care for COVID and healthcare worker who cared for COVID, the hazard ratio was 4.83 for adequate PPE, or 5.06 reuse, as well as 5.91 inadequate PPE. The emphasis here is on that the healthcare workers are the frontliners, and they could be really affected by the pandemic. Just to keep you all in attention and with me, in the early days with the plague pandemic, they were wearing these masks. And a funny story, they thought that they packed these peaks for like the birds. They used the bird because they thought it came from the bird. And the other thing is they packed it with nice smell, like mint or rose. They thought the good smell would take away the, make the pandemic go away. But I guess now with infection control knowledge, we know that that's not true. We'll continue. We already are all aware of the personal protective equipment. The preferred, of course, is the N95 high respirator, and the acceptable is the face mask. However, the idea here is we need the face shield. The face shield would first help you not touch your face, and then it would protect your mask as well for N95 for reuse. So what is very important, and I'm not going to go through what you wear and how do you wear it, but the idea here is the donning and doffing are very important because the sequence can break and transmit the disease and put you at risk for the transmission. So we are nurses at the end, and I am proud of you all attending, and we have an amazing big number here with us, and we could still keep nursing art in us. So some of the healthcare providers had pictures on their PPE because our patients are lonely, and we need to be there for them even if we are protecting ourselves. So another important thing is there are 3 factors required for the respirator to be effective. The way you apply it with the metal on the top, and we see a lot of this happening, the incorrect application, and then you see the aerosol all around, could be affecting how it's placed on the mouth. So this is very important, and the filtration need to be 95%. And of course, perfect fitting to prevent transmission. Why you should practice physical distancing. This was very nice from John Hopkins at Aramco Healthcare, and I thought I would share. It's very illustrative of how social distancing, but not only social distancing outside, also in the hospital. So again, it transfers through droplets, contact, indirect contact, and direct contact to susceptible individuals. However, also airborne with aerosol generating procedures. And as you've seen from the study, when they looked at the negative pressure rooms, it was trapped in the fans, and that is suggestive of airborne. Okay, we also worry about the surfaces and the environmental stability. So this is very important so that we protect ourselves. Modified droplet precautions are what the Mayo Clinic would like to call it in terms of what PPE we wear. And what is very important is the use of a dedicated equipment whenever possible. Disinfect equipment when removing from the room. So unfortunately, it's not just the COVID. COVID has become nosocomial as well. Nosocomial infection in patients with COVID was 44%, and this is a sad percentage. Patient attending hospitals should always take personal protection, and the medical staff should be aware of the disease to protect themselves and the patients. Okay. We need to be aware of aerosol generating procedures, and they should always be in a negative room, as mentioned earlier. I'm not going to go through this again. And there are high risk generating procedures, as you see in the top, and it goes down with the medium and lower stage. This was provided from the Mayo Clinic, which is nice for providers to for a checklist, and all aerosol generating should be in a negative room. PPE combination for aerosol generating. This is illustrative enough with the pictures. However, face shield, or one thing I want to emphasize, some healthcare professionals might think that their eyeglasses are protective enough for their eyes, and they're not. So having an eye shield is very important. And then with the unfortunate low supply on PPEs, reusable isolation gowns and disposable gowns and surgical may be used as well. So helmets, we've seen the Italians use the helmets. We've seen them in the news. They looked very interesting, and it might be something that we need to consider here. The problem, what happened is sometimes when the healthcare providers can't use the non-invasive, they would intubate the patients, and it would affect the patients who really need intubation. So there are different clinical scenarios when, for example, a traditional mask is needed and is not used, or sometimes using a high flow nasal cannula and not using it, ventilation, intubation could be affected. As you see here, this is a very nice illustrative picture here with the face mask, the full face mask, non-invasive ventilation. You see the aerosol here, and with the helmet you don't see anything. So what is nice about these, that they are comfortable for the patient, and they have other benefits. You could also look at a very nice publication about the helmet bundle that you could carry eventually if we have it here in Saudi Arabia. This is a very nice video illustration of what could happen. If you look at the first picture, it's high flow nasal cannula. You see the aerosol going up, and then the second picture was simulated spontaneous respiration, and then the high flow nasal cannula simulated cough, and no simple face mask. And then the last one with a simple face mask. Look at this. This is detrimental. Although we think it's a barrier, now look at the droplets, the aerosol that's happening to the patients, and it could really affect. This is a nice picture for hand washing. I can't emphasize hand washing more than but the recommendation, the CDC says 20, the WHO says 40, some says 30. So what is happening? What it really, if you see in the picture before washing, what happened in the first left picture, the rinse and shake, and then the 6-second no soap, seconds with soap, 15 seconds soap. I want to go through these pictures, even if you saw it on WhatsApp one day. 30 seconds soap. What happened? There is less contamination. So the idea here, it all depends on how soiled your hand is, if you're using soap or not, and how vigorously you're doing it, and sometimes it's trapped in the wrist as well. So if you haven't read this, I urge you to read this, Healthcare Professionals, Keeping the Coronavirus from Infecting Healthcare Workers. It was a public doctor, Atul Gandhi, what Singapore and Hong Kong success is teaching us about the pandemic. And this is the routine use of PPE, as we all know, and as discussed from previously, speakers, and the frequent disinfection and the grouping of patient by risk and the social distancing for everyone. So all hospitals should ensure their staff are trained and equipped and capable of practice needed to prevent the spread of the illness, to identify and isolate patients as needed, to care for a limited number of patients, and potentially care for a larger number in the context of an escalating outbreak, unfortunately, and monitor and manage healthcare workers exposed, as well as communicate. I want to emphasize one thing. In terms of healthcare workers, sometimes they might fear, like especially in the beginning of the outbreak, where we've heard stories as well, and where healthcare professionals wouldn't say if they have symptoms, and we have to make sure that we make it safe for them and be there for them, and for the leaders to be there.
I was actually surprised by that technical issue, because we went live 30 minutes prior, and we tried to share the slides on the speaker, and it was fine. So
Hello?
whatever happens in Ahmed's computers or on my computer, I'm not sure what it is, but at the end, it's gone. I'm relieved.
Hello, can you hear me?
It's fine, go on.
I heard something on the side, sorry. So we need to train our, as mentioned in previous slides as well, we need to train our, I hear an echo, do you hear it, Ahmed?
Yeah, I can hear you. Something
Maybe,
happened with Maha.
yeah.
With Maha.
Okay, it could be disturbing for the
التكنيكال ايرور اللي صار عارفه
Miss Maha.
Maha? I will call her. Just go on. It's fine.
Okay, so simulation is very important, and DHA has started early in the pandemic with simulation role for preparing with the COVID. They actually published it. It's a very nice article. So before this happened, there was a series on Netflix, and a lot are seeing Netflix, so I'll make it so I grab you all of your attention with what's happening. There was a series called Pandemic, and they kept saying in the pandemic, it's not a matter of when. It's not a matter of if, it's a matter of when. So were we really ready for the pandemic? And this is a lesson for all of us, as indicated in the previous talks. We need to go teach our staff through simulation. In the article, they indicated several aspects of where you could train your staff. What is nice is that everyone can implement simulation. You don't need high-tech fidelity mannequins to do it. It could be a role play with everyone together, and then you debrief about it. There are simulation exercises provided on WHO, as well as online training. The exercise simulation they have PowerPoints ready for you, they have the scenarios, and also Dr. Yasin Arabi and Dr. Sarah Dakhil are working on simulation bank for staff. If you haven't checked this as well, you need to check it periodically. As you see, it's always updated, the interim infection prevention control recommendation. I just took this picture on May 18, but if you go now, it'll be updated every day. So in summary, IPC for iPatient. In summary for the last talks, admission screening is very important, cohorting the COVID patients, and training your healthcare providers, PPE and simulation, and prevention of the transmission of the disease. And the picture is illustrative. IPC for outpatient, symptom screening for all patients. Now that all the patients are coming back and some of the outpatients are opening, we need to limit the visitors. Universal masking and physical distancing as well. And mask and eye protection for healthcare providers. I urge you, if sometimes there are eye protection supply problems, some healthcare providers have actually custom made their own eye protection masks. We can never forget our heroes, and I am honored to be amongst you all nurses. I am proud of you. والله يرحم موتانا وموتى المسلمين وكل اللي خسرناهم في هذه البانديميك، حتى البيشنتس اللي خسرناهم. وما نقدر ننسى أخونا خالد الحسيني الله يرحمه. I don't know him personally, but everyone was touched by his story. So we need to keep him in mind. You need to keep safe. You need to stop touching your face, please, because we need to stay alive for our patients and for our families. To all the healthcare providers helping with this pandemic, we owe you a debt of gratitude, and we may never be able to repay. Never, never. You are heroes and an inspiration to us all. And this was a captation from the health leaders, and we nurses are health leaders. These are my references, and I thank you all for listening. I hope it didn't take more than 15 minutes. I got excited at some point, but I am very happy to be participating in my first national webinar with SASM. Thank you, Mr. Ahmed, for this opportunity. It's a pleasure.
Thank you too much, Dr. Asima. We enjoy really the rich presentation. We have plenty of questions. We will be selective on it. The first question, I think, for Dr. Ahlam, regarding the physical support along with the psychological support, because many of the physical services are not providing as assured.
Can you repeat, please, the question?
She says, I want to know regarding the physical support and along with the psychological support. She mentioned that she is, or they are not providing as assured.
Sorry, repeat it again. Sorry.
I will rephrase it. I think she is not happy with the physical and psychological support is provided to them.
Yeah, sure. Maybe at the beginning of all the COVID pandemic, it was really hard for the administration to give the full support, because it was really at the beginning, we only care about how we will manage the situation. But I think they supposed after 6 months, after 6 weeks, all the organization think about it, how they can support. For example, in the psychological part, they can assign, as we did in our hospital, helpline, or they have to find a way or assign a psychologist in any clinic. For the physical support, they can encourage them, for example, for having a walk around their building, or when they are free, doing yoga. It depends on the organization, but please, yani, just understand us as in the administration. Sometimes at the beginning it was really hard, because we have to, usually you have to give the supply and give attention more how you manage the situation. And after that, all the administration realized that we need also to support them psychologically and physically. And you can go simply to your nursing administration and just tell them that if you have any idea how you can support the nursing staff, and it will be great if it came from the end user, from the nursing bedside care. I believe they really need, they understand more than us what they really need. So we will support them. And I encourage all the nursing administration now, please pay more attention for the psychological support and the physical support.
Thank you. Dr. Amal, there is a question regarding the job description of quarantine nursing. Do they need a special nursing skills, or basic nursing skill is enough?
Very good question. If we have two different categories, we have the quarantine hotels or facilities for negative cases, and we have the isolation facilities for positive cases. So the nurse working in each facility have different assignment, different job responsibilities. So for those who's working in the quarantine with negative cases, their responsibilities and assignment for daily nursing care is to follow up on the guests and ask them if they have symptoms. So this job basically required no special skills. I mean, any general nurse can, even nursing aide, under supervision can perform this assignment. However, in the isolation facilities, and you are working there, Mr. Ahmed, you know that you have different responsibility. In the beginning, we were very concerned about the quality of nurses and qualification skills of nurses who will be assigned in the isolation facilities. So they require to have their basic nursing skills, their PICSELS training, and the infection control training, and the COVID-19 precaution. These are the very important skills, because they will be in direct contact with the positive cases. So their safety plus the patient safety is very important to us. So these are the basic skills they required.
Thanks a lot, Dr. Amal. Dr. Asima, someone is asking, the infected nurses are very less compared to the physician who are infected in this pandemic. Any factors to be concerned?
Very interesting question. I saw it earlier on. I was proud again with our nurses. However, Don't we all see it sometimes in clinical? And I apologize to the doctors who are hearing us now, but nurses are more compliant with the infection control precautions, and please remind our doctors to do so. So I don't have any, this is all I can say. I can see another question. There's a lot of healthcare worker wearing surgical mask under, is it correct? Actually, what I'm very concerned about, it would affect the fitting. So the N95 as is good enough, so I don't know why they're doing that. However, what could protect the N95 is wearing a face shield on. Again, fitting of the N95, this wearing the surgical mask could affect the fitting. The other thing I could also add is the reuse of these masks. So recently everyone has been thinking of reusing, and they found that the N95, what they're doing now in some of the hospitals in the States is they wrap it in a brown bag and and label it, of course, and they use it by the provider's name and use it after 5 days. And they believe that after actually 2-3 days, it's similar to a cardboard surface. It would there would be no contamination. So they're suggesting the reuse because of the decreased supply. However, we don't want to really think of reuse unless there isn't any supply accordingly. Somehow the literature does show that this is from the literature, that they offer equal protection in real world setting. And several studies, they compared the N95 with the medical mask during the 12-week peak of the virus. There were no difference in the lab confirmed influenza of N95 and compared to the medical mask. This was with influenza. So I don't know. This is all I could add. Thank you.
Right. Thank you so much for all the speaker, and thanks for the audience who attend the webinar. Thanks for the nurses who are working in frontline. You are heroes, and your country is proud of you. We will continue stuck on this thing till the end, and همة حتى القمة. Any other words, speakers?
Thank you for an amazing webinar.
Yeah, and I want to thank you, Ahmed, for the opportunity that you gave to us. And also, I want to extend my appreciation to every single nurse, either she is infected or even the nurses who are still at the front lines. What they are doing is really amazing. I know 2 personally who are infected, but they still want to give more and more and more. So thank you for the spirit that they have. Thank you.
Thank you.
Thank you, everyone, and I apologize for the technical challenge.
You're welcome.
يعطيكم العافية جميعا. Thank you everyone. Thank you Mr. Ahmed for moderating this proper session, and thank you for all the speakers and the attendees. On behalf of SASM Medical Education Section, we really appreciate this nursing webinar, and we really appreciate this huge number attending until the last minute. It's very much appreciated, and we hope it's the first of a non-stop of continuous webinars. Thank you all, and see you soon inshallah. يعطيكم ألف عافية.